The age-old debate, is Medicare Advantage the best or the worst? Let's dive in. A lot of people are always debating whether Medicare Advantage plans are the best plans ever created or the worst plans out there. And there are hundreds of YouTube videos saying one thing and the other. As a consumer, it is impossible for you to tell who's telling the truth. Are they the best or are they the worst? Well, what if I told you that it could be both? And it's completely dependent on a few things, including your location, meaning the state that you live in, and the scenario that you're in, which can differ based on person to person. So let's go ahead and dive in here, starting with location, on why the Medicare Advantage plan might be the best thing ever if you live in one state and the worst thing ever if you live in another state. For a simple example, Medicare Advantage plans, and we'll define this before we go any further, Medicare Advantage plans are built to be equivalents to original Medicare, but offered by a private company instead, and often for no extra premium. So you're getting this equivalent pay-as-you-go style plan to Medicare, offered by a private entity for no extra charge. And on the surface, it sounds great. If you're a healthy individual, you just pay as you go, and if you're not going, you're not paying. That's awesome. And in some states, the pay-as-you-go structure is phenomenal. In some states, what we've seemed to have found is that, for one thing, every Medicare Advantage plan has an out-of-pocket max. And an out-of-pocket max is the limit that you can spend each year before the Advantage company or the insurance carrier picks up all of the costs thereafter. For example, if you had an out-of-pocket max of $10,000, after you spend $10,000, the insurance company pays the rest. It's a large safety net that exists in the plan. What we were able to deduce is that in some states, the out-of-pocket max is extraordinarily low. Some states, they've got out-of-pocket maxes that are $1,000 or $2,000 total, meaning after you spend $1,000 on medical services, they cover everything else thereafter. That's crazy in a state where, say like here in New Jersey, most out-of-pocket maxes are in the $6,000, $7,000, and $8,000 range. To think that with two different Medicare Advantage plans in two different states, one of them could have an out-of-pocket max of $1,000, and the other one could have an out-of-pocket max of $8,000, seems crazy, but it is the truth. And that's one of the first pieces that will define for you, is a Medicare Advantage plan good or bad? Well, it depends on the state you live in. If it's only a $1,000 out-of-pocket max, that's not bad at all. That's pretty good. But if it's an $8,000 out-of-pocket max, that's a totally different scenario. Not only do the out-of-pocket maxes change depending on what state you live in, but so do the copays. We've had people move up from certain states where they're amazed to find that in New Jersey, there's a copay for everything under the Medicare Advantage plan except for the primary care doctor. In other states, it seems to be that that's not really the case. A lot of it is a $0 copay. Again, all dependent on the state you live in. So when you're getting advice from your friends saying, I have an Advantage plan and it's great, and somebody else says, I have an Advantage plan and it's terrible, it depends on what state they live in. That's going to make a huge difference in that scenario. So the first thing that we want to focus on is, what state do you live in? This will make a big difference in how good or bad that Medicare Advantage plan might be. The second reason that it might make a big difference depending on the state you live in is that the comparative option to a Medicare Advantage is something called a Medicare supplement, where you keep your original Medicare and you supplement it for an ancillary cost. If Medicare picks up 80%, the supplement's there to pay for the other 20%. In some states, a Medicare supplement might be $100. The difference between being covered at 100% with a supplement or paying along the way as you go with an Advantage plan might be $100 a month. But in some states, a supplement might be $300 or $400 a month. That's a huge difference. And to pay $300 or $400 a month to be covered at 100% might not be worth the payment when a Medicare Advantage plan has a $1,000 out-of-pocket max and you don't have to pay anything for it. It all depends on the state. So that is the one thing that makes a huge difference. If you're debating for yourself between an Advantage plan and a supplement, or you can't decide what's best or what's worst, don't take a generic YouTube video and run with it. Things are different depending on the area you're located in, and you want somebody who knows your area so that you can get the information that's specific to you, because that's going to make a huge difference. Now, on to our second situation, okay? Not only does location play a role, but your scenario plays a role as well, okay? And the scenario has to do with what you're facing medically, basically, okay? In a Medicare Advantage plan, the Advantage plan must approve all services besides a primary care visit, for example. So if you need a CT scan, an MRI, a hospital stay, a rehab stay, the Medicare Advantage company needs to be the one to approve or deny that service. Now, in some areas, again, this kind of ties in with the location situation. In some areas, there's a lot more or less what they call provider friction, meaning the Advantage companies may ask the doctors to jump through more hoops in certain areas to have simple services covered. Here in New Jersey, for example, if a client wanted to get an epidural because they've had nerve pain or they've got back pain, the Advantage company may ask the doctor to prove that they've done a full spinal workup, that they've done a large amount of x-rays, that they can prove the nerve pain goes all over the body, that they are participating in an exercise program. They might ask the doctor to jump through 5 or 6 different hoops before they approve something as simple as an epidural. Where in other areas, that might just not happen. Maybe the company doesn't ask the doctor to jump through the hoops, or maybe the doctor is more accustomed in some areas to jumping through hoops than they are in other areas. Using New Jersey, where we're from, as an example, some doctors have to see 100 patients a day. They don't have time to stop for one patient and jump through a plethora of hoops to get one simple thing covered. So it's denied and it's denied. They don't jump through the hoops and it's over. That's much different than in a small rural area in which the doctor isn't funneling through 100 patients a day and they have the time to stop and do what the insurance company is asking for to make that happen. The second thing that can play a huge role there is whether it's a small doctor's office or a doctor's office that's part of a huge conglomerate like a hospital system or a larger medical group, because single small family doctors, if they need to jump through hoops, that doctor is the one that needs to jump through hoops and do what the insurance company needs them to do to get a service approved. If the doctor works for a large physicians organization or is under the umbrella of a large hospital affiliation, that doctor may not have to jump through any hoops. The hospital affiliation will jump through the hoops for them. The doctor's admins will jump through the hoops for them, letting the doctor do their job and letting the entire administrative team deal with the insurance company. Small doctors' offices don't have that blessing, for example, to have a whole team working on their behalf, whereas larger doctors and hospital groups do. And in addition, most Medicare Advantage plans are formed in partnership with large hospital groups, which means those hospital groups might know exactly what the company is going to ask for every time. They might jump through the hoops before the hoops are even laid out for the doctor. So, depending on where you live, there might be a lot of provider friction. Maybe there's a lot of small doctors that aren't a part of hospital groups that just can't jump through those hoops that the insurance companies ask for. Or maybe there's a little bit. Maybe in your town, one hospital group owns all of the doctor's offices and they know how to do exactly what the insurance company is asking for. So our second point here is that depending on where you live and what your situation is, well, the doctors may have a lot of resistance in the Medicare Advantage plans for getting simple things covered, and they may not. And that is one of the largest things we see about the debate between if Medicare Advantage plans are good or bad is, are my services going to be covered? Because for some people, they might be denied things like a CT scan when they have cancer. They may be thrown out of rehab when they get done a hospital stay. And for other people, that's not the story whatsoever. So it is completely dependent on your scenario, your doctors, and your location for, are my services going to be approved in this Medicare Advantage plan or are they going to be denied? So far what we've gone over is this. Number one, depending on where you live, the cost of a Medicare Advantage plan out of pocket is going to be different. And depending on where you live and what your scenario is, the coverage you receive in that Medicare Advantage plan is going to be different depending on how much they ask the doctor to do or how much the doctor can handle doing to get services approved for you, because every Medicare Advantage plan requires authorizations on every service. Just to reiterate, because we haven't talked about this yet, if an Advantage plan requires approval on all services, keep in mind that usually Original Medicare and Original Medicare with a supplemental has a lot less restrictions and doesn't require the doctor to jump through a million hoops to get services covered. It's a bit more liberal. And if the doctor says it's medically necessary and there's a code for it, typically Medicare will cover it, okay? So our last piece to this video is again scenario-based. A lot of people who say a Medicare Advantage plan is the best thing they've ever had may be involved in a different type of Medicare Advantage plan that may or may not be available to you, because Medicare Advantage plans also have something called dual special needs Medicare Advantage plans, which are built for those people on Medicare and Medicaid. And if you're on Medicare and Medicaid, you may have access to what they call a dual special need Medicare Advantage plan, which means, in general, everything is free. There is no copays, there is no out-of-pocket max, there's unlimited dental and hearing and vision, there's large over-the-counter benefits for groceries, for over-the-counter items, for paying your bills. These dual Medicare Medicaid Advantage plans are a totally different animal compared to a regular Medicare Advantage plan, and there's two things that make them function a lot better than a regular Medicare Advantage plan, which is that a dual special needs plan usually assigns the member a care manager, and a care manager can help them coordinate doctor's visit, help them go through escalations and get things covered if they're giving the doctor issues. And secondly, everything is free. So you don't pay for anything. And if a friend has a dual special needs Medicare Advantage plan, they're definitely right to tell you it's the best plan they've ever had because everything's free and they've got a personal care manager to coordinate their care. But if you don't qualify for Medicaid, you can't have a dual Medicare and Medicaid Advantage plan, and that's not an option for you. So again, when you hear a Medicare Advantage plan is the best plan or the worst plan, it's totally situational. Depending on who told you that, or who's making the video, it all depends on the situation you're facing. Where do you live? What kind of doctors do you use? Are you within a hospital system? Are they talking about Medicaid, Medicare plans, or just Medicare plans? So there are so many things that go into this question that my answer to, is Medicare Advantage plan the best thing ever or the worst thing ever? Well, it's the answer everybody hates to hear, but it depends. Depends on where you live and what your situation is. So if you want to know whether a Medicare Advantage plan is right for you or not, or get a full education about Medicare Advantage versus Medicare Supplement, reach out to a local broker like ourselves. You can reach us at www.njlifeandhealth.com or give us a call, 848-226-6897, and we're happy to educate you and walk you through no matter what state you live in. And if you want any further information, feel free to watch our videos. Our YouTube channel has a lot more educational videos in which you can view at your own pace.